Hi everyone, this is Dr. Fox. Let's talk about the ophthalmic artery and veins. In this video, we'll diagram the branches of the ophthalmic artery and veins. The most difficult portion of all of this is just remembering how to spell ophthalmic. Remember, PHTH. So the ophthalmic artery is the principal source of blood to the orbit and its contents. It's the first branch of the internal carotid artery, and it's going to enter into the orbit via the optic canal, along with cranial nerve 2. Once it enters the orbit, it assumes more of a medial course, and oftentimes you can find this muscle between the muscle bellies of superior oblique and the medial rectus muscle. It has many different branches, and its branches accompany and are oftentimes named for their accompanying branches of V1, or the ophthalmic division of the trigeminal nerve. One of the more important and fun to find branches of the ophthalmic artery is that of the central artery of the retina, and I will circle it for you there. Here we're looking at the posterior aspect of the eye, and the optic nerve has been cut, and we can see the central artery of the retina, or the central retinal artery, bundled within the dural sheath of the nerve here. The ophthalmic veins are going to drain the orbit as well as surrounding spaces. There are two major conduits of veins serving the orbit: the superior ophthalmic vein and the inferior ophthalmic vein. The superior ophthalmic vein is going to drain the superior orbital contents as well as regions of the eye, and medial to the orbit, the ethmoidal air cells. It also is going to receive drainage from veins of the face, so superficial face and forehead. Whereas the inferior ophthalmic vein is going to drain the more inferior aspects of the orbit, as well as portions of the deep face, such as the pterygoid plexus of veins here. Now, these veins represent a potential conduit from infections of the superficial face back to the cavernous sinus. So they may travel from any superficial infection along this route. Oftentimes, these veins are valveless, and the infections can move right through. Thank you so much for your time, and I look forward to talking to you in the next video.